Well, I'm about ready to do a, I guess, pre-surgery interview with the doctor. He's getting ready to come in here. Whew, man, this is nervous. I'm getting nervous, man. Yeah, right. I'm gonna be 24 hours from now. I'm gonna be in a massive amount of pain. I'm gonna do this, but I'm telling you, I am stressing. I'm really stressing. I'm not going up and run. You know, Judge Delahy playing some notes on my Stradivarius right about now. You know, again, treated like a patient in California. You know, I'm in a hospital medical room right now. In New Jersey, I'm treated like a criminal, and I end up in a cell. You know, actually I ended up in a cell. Let's see, I actually have something right here in front of me right now. From October the 20th, September the 20th to October the 8th, 20 days. October the...
Dude.
Oh, hey, how are you, Doc?
What's happening?
I'm
you
alright.
on voice chat?
No, actually, I was talking to myself.
Oh, okay.
Just talking about surgery. You mind? I won't put your image on
no,
there.
no,
Just
not at all.
Just
Not
audio of me.
Happy to... Yeah, no, it's good to clear up any questions or confusion. I do like to generally see people the day before, so it's good that
Right.
we're catching up.
Thank you.
Any questions on your end about anything?
Well, you're actually going for taking it out and not the knee replacement. You're just going to try to
Scoop it out.
scoop it all out.
Scoop it all out.
But if there's an issue, I'll be asleep. So if you decide you can't, you'll just do the knee replacement.
Yeah, I think we'll be able to scoop it all out.
Okay.
So the questions here are really the tougher question is what to fill it with, and I think we agreed we're going to use cement for all the reasons we talked about.
Yeah.
But I mean,
Plus, I went through that before, taking it from somewhere else. That I think the hip, taking it from the hip hurt more
Was
than
more
the leg.
painful than-
I
yeah.
had more pain out of that than I
Yeah.
did from the knee.
so we'll put cement in there. The other question we've got to ask ourselves is whether we need to put a plate on there as well to give it some more stability. And the question really becomes, how quickly are you going to need to get back on it? The downside of the plate, it's a little longer surgery, it's a little more, plus there's another thing in there that can get infected. The upside is the bone is stronger right away and lets you get up and get moving right away.
Well, that's what I need. I'd rather have a quicker recovery.
Yep.
Than I'd rather have a quicker recovery.
You'd rather have fewer limitations
Yes.
post-op. Because I guess quicker recovery can be looked at from either end, right? 'Cause
Yeah.
in a sense it's more surgery, so the speed of recovery might be a little longer actually, or slower. But it does allow we'll let you put weight on it right away and get you moving.
How long will I was getting ready to ask next, how long will I be off my feet?
Well, so we'll give you crutches,
Right.
but pain is really going to be your guide. I mean, assuming that cartilage surface holds up and the cement is there and the plate's on there,
Right.
I think we could get you up bearing weight on it right away.
Really?
It's going to hurt,
Yeah.
so I don't mean to say
Yeah.
you're going to be jogging out of the hospital,
No.
but
Okay.
probably not too prolonged in terms of being off your feet.
Okay. And I'm assuming I'm gonna have staples.
So we generally close with either staples or a nylon suture on the skin.
Okay.
There's advantages and disadvantages to both. And for me, my rule of thumb is just staples, I use them if there's not much tension on the skin. If there's a fair bit of tension, I use a nylon stitch because it's a little hardier.
Okay.
But either one is their equivalent,
Okay.
unless you have
No,
had a
no
reaction
question.
or something.
No, I was just kind of figuring out how long am I gonna be, like the follow up to cut them out or
Either
take
way
it.
is about 2.5 weeks.
Okay. All right. Yeah, I guess that's it. 3 days in here, and I told them about my situation. I really didn't have anywhere to go or anywhere to nurse me or whatever, or to, if I needed any aftercare. But how much aftercare do I need other than stay off my feet?
Yeah, I don't think a ton. I mean, where are you staying right now?
I'm gonna be staying in Hollywood. Basically, I'm riding somebody's couch.
Okay. But I mean, you do have a place.
Yes.
I just don't want you, outside type thing. I mean,
no,
you got a buddy to stay with.
Well, I talked to Tanya. What I was supposed to do is, she said that I'll probably be here in the hospital for 3 days, and then when I got released, I was to talk to intake about a rehab place for a few days.
Yep. Yeah, no, we'll work on all of that stuff. I just want to make sure.
Oh no, I'm not actually on the street. No,
setting you up to be like, because especially when you put a plate in there, there's a lot of risk for infection. I just want you to be somewhere clean. Somewhere that you're in a place you can take care of it. Yeah. But I don't think in terms of how much you'll need in terms of actual assistance, it'll be a huge.
Okay.
We'll have a dressing on there. You'll be able to shower at a week out from surgery. But yeah, I think the cement is a good plan if you need to get going quickly.
Yeah, I'm going with the cement then.
Okay.
Yeah.
And then, this is, I think this, so the other thing, I don't know if we talked about or not, but you've got that area down there in the condyle.
Right.
There's also a little signal, remember we showed you that signal that's
further,
higher up? We're going to scoop all that out.
Okay.
I just want to get it all clean. If we're going to do this, let's get it all done.
Yes.
So
when I was looking at the x-rays, I mean, it looks like yes, the one on the knob, and then the other one that you're talking about, but then it also looks like there's like cracks or lines, like they were growing together, like.
I think those are all the same process.
So it's all one.
I think it's probably contiguous to some degree, but hard to know, and we'll keep the two specimens separate, so we'll scoop out one, then we'll go up to the other one, and that way pathology will be able to tell us, was number 2 the same as number 1, was it just some other, but the assumption is that they're the same.
Right. But the little crack, like I'm not, obviously I'm not don't read x-rays, but I can see, it looks like there's a line between them, so would that line also be technically a lesion too?
We're going to scoop out everything on that side. Okay. Yeah, I mean, it's going to be a pretty good size hole. But we'll fill it with cement.
I'm just thinking about this pain. I remember
don't.
Pain. That's what I remember the most.
Yeah, don't psych yourself out about this.
I know. I'm not. I'm
I mean,
here. I almost didn't come. I kept thinking to myself, maybe I can put it off a little longer. Maybe I can use it to those about a couple more months.
You could.
I know.
But it's just going to keep getting bigger and bigger and more surgery. At the end of the day, I think our likelihood of getting this out without needing that big knee replacement endoprosthesis,
right.
Now is we should get it done.
I'm here. I'm going for it.
All right. So risks of surgery, like we talked about, infection, bleeding, nerve damage, risks of all surgeries all the time.
Right.
The big risk here is if we find out that it's something more aggressive, then we'd have to go in and do a bigger surgery, which I think the likelihood is very low. Again.
Sounds good to me.
All right.
All right.
We'll talk more in the morning.
Yep. So I'm scheduled at 9:30, 9 o'clock, something like that. The second one.
Is that right? Yeah. I haven't looked at the schedule yet in terms of what number. Okay.
Yeah, Tanya just told me to be here at 7 o'clock.
Okay.
Do the whole intake admission thing, and then.
Yeah, Tanya's the boss when it comes to that stuff. Okay. I show up where she tells me.
All right. Thanks a lot.
All right. Good to see you. Sleep well tonight. Don't psych yourself out. We'll take good care of you.
I know.
Okay.
No eating after 12, right?
No eating after 12. Get a good night dinner.
All right. Thank you. Well, that was my pre-surgery.
All right, you can leave.
Oh.
You're all set.
Oh, okay. I'm getting kicked out of the room.
Yep, you can get discharged out of the room.
No, it's all right. I'm just joking.
Yep,
I'm
when
joking.
you finish, you can take your time.